Hi, my name is Aubrey Oliver. I am called Dr. Aubrey, sometime Dr. Oliver, whichever is comfortable. I work with it. I live in the state of Florida, and I've been here some 15 years now, and I love it. I started out doing some master running about 6, 7 years ago, and you're getting up in your 40s. You're like, what is going to be my midlife crisis? So master running came, you know, in good, because I used to run back in high school and college, but it's been a while, 20 odd years in between those running. So when I first started running, I used to put a lot of mileage in because I was trying to do more of the 5Ks and the 10Ks, and then I got up to half marathons and so forth. I haven't got to no marathon, but back then the training was horrendous. It was tough, and I used to get a lot of knee pain. Basically, my knee would be sore. And I met a friend of mine, Alexander Hevia. He basically introduced me to Comra, and I remember treating my knees not that many times, maybe 3 or 4 times, and I have not had that knee pain since. Other pain arrived over the years, but not that one. I run like amazing. I did very well. I even became a national champion with a relay team. So it was amazing. And that championship year, I was doing it with Carnival Cruise. They had a master team they put together. Went up to Kansas, and I remember I used the Comra to stimulate my nervous system before the races, and trust me, it was amazing. At 40 plus, 45 plus, I was doing I did the 400 heats that day. I did 800. I think I did the 200 also. I came back and I did the 800 relay and the 4x400 relay, and that's in the 800 relay we won the championship. So Comra has been amazing for me, but at the same time I do practice energy medicine in Jamaica with a background in cell regeneration therapy, and Comra is the perfect holistic tool for that. I work with patients that range from arthritic to prostate issues. I also work with a lot of stroke patients, and I must say, over the years, also autoimmune situation, and I must say over the years, it's a good results have been up in the 90% and above. Good results once people stick to the treatment. I've seen at 80 79-year-old that basically came to me with prostate the size of a grapefruit, a large grapefruit, when they came with their basic diagnosis, ultrasound. And within a month of treatment, it was reduced to half. They took a break, another month, was back to normal. This patient even had cancer in his prostate, and that disappeared in the prostate. So basically, I've seen a lot of success with the prostate treatment. The other thing I've seen great success with is strokes. When they're totally depleted of energy, the cells, and they're just lying there after the oxygen, did not get to the right parts of the body, and they're basically paralyzed. And I've come in with Comra, and I've worked on patients. Some of them, if they can afford it, we do it every day. Others, every other day. And I've seen within 2 weeks, based on how much time, they start moving, they start getting up out of bed. I mean, you energize those cells with the camera therapy. It's amazing. I've had patients that just come for weird pain. I remember this one guy. He had the pain in his stomach, the right side of his stomach, for 20 odd years, he said. And he's been going to this doctor that introduced me to him for like 5, 6 years, trying to get rid of this pain. And it's just been medication after medication. And I think he came in once or twice for the treatment, and the pain went away. That doctor actually went and ordered an equipment online, and it was amazing. So I would say I'm batting a good 90% and above with this camera with my patients, and it's been the best addition to my practice, along with plant-based treatment and herbs and stuff that comes through holism of the 21st century that I'm learning. So I must say it's been a wonderful trip, and I'm looking forward to helping a lot more people with camera therapy.